Olive Fertility Center, Progesterone Intramuscular Injections. Progesterone IM injections and vaginal progesterone tablets are used for patients undergoing an embryo transfer or a mock cycle for endometrial receptor assay (ERA) testing. Progesterone IM and vaginal progesterone tablets are taken to prepare the lining of the uterus for embryo transfer. You will continue to take this medication after your transfer to support implantation of the embryo and until the 10th week of your pregnancy. The progesterone IM that is used at Olive Fertility Center is mixed in an oil suspension. You should let your medical team know if you have any allergies before you start taking this medication. Progesterone in oil comes in a vial like this. Your dose is 50 milligrams, which is 1 cc or 1 milliliter. There are 10 doses in each vial. Most patients take one 50 milligram injection every 3 days, but some patients are on daily injections. Your nursing team will confirm how often you will take this medication. Injection supplies. We will provide you with enough injection supplies, syringes, needles, alcohol swabs, and cotton balls to get you to your first pregnancy test. When your pregnancy test is positive, you will need to buy more medication and pick up more injection supplies. Injection technique. Wash your hands. Lay out supplies on a clean surface. You will need the medication vial, one 3 cc syringe with 22 gauge 1.5 needle inch, an alcohol swab, cotton ball or Kleenex. Draw 1 milliliter of air into the syringe. Insert the needle, inject the air and invert the medication vial. Making sure that the tip of the needle is in the fluid. Pull back on the plunger until you have 1 milliliter of medication in the syringe. Remove the needle from the vial. With the needle pointing upwards, tap the syringe gently to remove air bubbles. Carefully recap the needle and put it down on your clean work surface as you prepare the injection area. Injection technique, landmarking dorsogluteal site. You will inject into the upper outer quadrant of your buttock muscle. Draw a horizontal line across the top of your buttock area. Divide the buttock area in half vertically. Choose the upper outer quadrant to inject. Injection technique, safety. Cleanse the area with the alcohol swab. Hold the skin taut. Do not pinch the skin like you might have for your IVF injections. Hold the needle like a dart and inject at a 90-degree angle. Insert the needle all the way. Stabilize the syringe with one hand. Pull back slightly on the plunger. You may feel some resistance. That is okay. You should not see blood in the syringe. Inject all the medication, then pull the needle out quickly. Massage the area lightly. Carefully recap the needle and discard it in your sharps container. Bring your used needles back to Olive Fertility or your local pharmacy. Do not dispose of them in your regular household garbage. Injection tips. If the site is sore, apply a warm compress. Don't be alarmed if you start to feel small lumps in your muscle. That is the progesterone oil, which takes a while to be absorbed. The medication is absorbed immediately. Alert! If the area becomes hard, red, swollen, and warm, please contact Olive Fertility immediately, as this may be a sign of infection. Injection technique, outer thigh site. You can also do your injection in your outer thigh muscle, vastus lataris. This may be easier to do if you are giving the injection yourself. Prepare the medication in the same way as previously discussed. To landmark, place one hand on your hip pointing downward towards knee and place your other hand on your outer knee facing upwards. The injection site is the middle outer area of your thigh muscle. Swab the injection site with the alcohol swab and inject at a 90-degree angle. Pull back to check for blood. If clear, then inject all the medication and remove needle quickly. We hope you find this video helpful and wish you all the best in your treatment cycle at Olive Fertility Center. If you have any questions, please call the Olive Fertility Nurse Line. Olive Fertility Nurse Line, 604-559-9950, extension 2300, 7:30 a.m. to 3 p.m., 7 days a week.